Dental implants are well proven to assist many people who've had difficulty retaining their dentures or their bridges in their mouths. Many of these people can return to optimum chewing ability and aesthetics with just a simple implant or so placed into their mouth. Dental implants, little metal screws, are one of the most important innovations in the entire history of dentistry. They're available to you if your dentist recommends that they're appropriate treatment for you. Many dental patients have difficulty holding their dentures in. Do you? Often it's related to inadequate bone quantity, or maybe you're too debilitated, or maybe you don't desire to have grafting of bone from some other part of your body into your mouth, which can be done. Dental implants have allowed these people to have dentures that function far better than restorations without implants, assisting in their retention and support. You know how your denture fits if you have a denture. Some of you like your denture. You wouldn't be watching this if you did. Many people have difficulty with their denture. What can be done? Although there have been many types of dental implants over the years, the current popular type of implant is similar to the root of a tooth. There are numerous diameters and lengths of these screw-like implants. You're observing a standard diameter implant on the left, which is slightly smaller than 1/8 of an inch, or 4 millimeters in diameter. On the right are two small diameter implants, which we're talking about today, and they're only about 1/16 of an inch, or 2 millimeters in diameter. In the model you're now observing, the lower jaw has a significant amount of bone. Two larger diameter implants can be placed in the bone to support and retain a lower denture quite well. These dentures with implants under them have a long history of producing excellent results in happy patients, but many people don't have that amount of bone. How come they don't? Because over a period of years, the bone shrinks, and as it shrinks, it becomes narrower and narrower to the point where a standard diameter implant of 1/4 of an inch or so cannot be placed in there. And when there isn't enough bone, what do? Smaller diameter implants must be used, unless the patient wants to go through bone grafting into the shrunken site to allow the larger implants to be placed. Many people don't want to do that. The grafting procedure requires a surgery and a significant healing period before the implants can be placed. Upper jaws have the same bone shrinkage challenges over a period of time. Note these models showing the shrinkage of the upper jaw from having the teeth in place to the point where there's almost not enough bone to do anything. The x-rays show on the left the patient's upper jaw with a very small amount of bone, necessitating small diameter implants or bone grafting, and on the right, another patient's jaw with an adequate amount of bone for larger diameter implants or small diameter implants if the patient wants to do so. They're less invasive and easier. Your dentist will inform you about the quantity and quality of the bone in your mouth and the type of dental implants that you could have placed. In summary, small diameter implants are needed because there's not enough bone in your mouth for larger implants. Your dentist will tell you. Or you do not choose to have bone grafted to allow placement of the larger diameter implants. Your overall health requires a relatively non-traumatic procedure that small diameter implants provide for you. Some of you are debilitated. Some of you have diabetes. Some of you do not want to have the trauma of a significant surgical procedure. Then you're talking about small diameter implants. There are numerous uses for small diameter implants. Notice the little metal objects in the gums, and they're the implants going down into the bone. From most to least used, they are lower complete dentures, upper complete dentures, removable partial dentures. Many of you have removable partial dentures that just won't stay in. Fixed bridges, a less common use. and some single missing teeth, even less common use at this particular point for small diameter implants. This video emphasizes complete dentures. Please ask your dentist about some of these other uses. You're looking at a model of a lower jaw with not much bone. How about if we put 1, 2, 3, 4 small diameter implants in that? And then we connect to those small diameter implants various levels of attachments, which you're now going to see on models. This model demonstrates 4 small diameter implants in a lower jaw. A denture has been made to simulate a denture for a human. And look, in that denture, there are little housings with rubber washers in them. Let's put that denture onto the model and push it down into place. Do you think that'll hold that denture in? I often ask patients, take your tongue and try to lift it out. Some of you have no trouble doing that. You can lift it out with no effort at all. However, if I take this and attempt to take it off, I have to jiggle it and use significant force, and I finally am going to get it out. Now, there is one form of small diameter implant retained and supported complete denture. Another major player in the small diameter implant marketplace uses a little larger sphere, as you can see. And the denture that's to go over the top of that has a soft rubber-like material in it. Some of you have had that in your denture as a so-called soft denture liner. Now, when that is placed over those larger spheres and pushed into place, again you have resistance to taking it out. Again, I'll have to jiggle this somewhat, and finally it will come off. Only disadvantage of this form is that from time to time the denture soft liner must be replaced. This model shows a simulation of the implants actually in what would be the patient's bone, with interlocking connections that fit into the corresponding ones in the denture. As they're placed together again and pushed into place, they tightly interlock. This one is a little more stable. However, it requires good bone in order to hold that much rigidity. It would have significant resistance to retention, just as the others. Your dentist will describe to you other orientations that could be used over those 4 mini implants. Please talk to him or her. And how do you think patients feel after 20 or more years of having a denture that won't stay in? This little 87-year-old man, months after we had placed the denture in, came in on a recall appointment and actually stood there and cried because how he felt was such a positive feeling over what he had had before. What are your alternatives to having small diameter implants? You can stay as you are without any implants. I don't think you want to be there or you wouldn't be watching this video. You can have larger diameter implants placed if you have enough bone, but they're a little more invasive, a little more time consuming, and often you have to wait before you can attach them to the denture. You can have various other types of restorations retained and supported by implants, such as the so-called bar and clip supported and retained denture you're now viewing. That patient was extremely happy, but it was quite a laborious procedure. Ask your dentist about alternatives for your specific situation. Small diameter implants are just one, but a very popular and successful one. Small diameter implants, or so-called mini implants, provide the following advantages for you. You've pretty well seen them. The surgery is quite minor and with almost no complications. Occasionally some arise. There's a simple, uncomplicated placement. The retention and support of your dentures or other loose dental restorations is immediate, unlike many of the other procedures that require months to be completed. It can be somewhat lower cost than other implant options. I suggest strongly that you talk to your dentist to answer any of the questions that you may have now, and I'm sure you will find that small diameter implants provide one of the easiest, fastest, and probably best of the alternatives.